All right. Good morning and good afternoon, everyone. Thanks for joining us today for this Q&A webinar. My name is Matt Karst. I will be the moderator today. I'm a marketing specialist at Rainbow. And today we have three guest speakers. We have Kyle Narvison, who is our operations manager, Paul Schoneke, who is our inject care foreman, and Jesus Lopez, who is our warehouse and equipment supervisor. Few housekeeping slides before we get started. If you have any questions, this format is a little bit different if you've been with us for any of our other webinars. If you have any questions during the webinar, feel free to type them in the Q&A box and we'll hit those as they come in. This is a Q&A forum, so the format of it, we will go through and ask questions and then our speakers will answer. So if anything comes up during that you have a question, feel free to type that in and we'll address them. Also, one more thing, there are no CEUs for this one. We applied, but it did not meet the correct criteria. So with that, we will get started. And our first category is equipment. All right, so first question, how do you stay in front of or on top of equipment maintenance? We'll start that off with Jesus, if you want to start.
So we pretty much implemented a process that they have to maintain their equipment on a daily basis, on a weekly basis, and on a monthly basis. And for the most part, during the daily basis, is just more of cleaning the outside of the equipment, just keeping it clean, making sure that it doesn't get sticky, full of dirt and all that. With the dirt, it tends to get inside the grooves, oil rings, and all those components, and it creates a lot of failures. We do a weekly check-in. We monitor how well they're upkeeping their daily maintenance. We kind of do spot checks on their equipment, and we flag them. So every once in a while, I go in there, and I try to do once a week, and I go through their equipment and I check and see how they're doing their upkeep, and then we flag them if they're not maintaining their equipment. And then we basically, before they're able to go out and do any production, they have to clean their equipment.
All right, perfect. What are essential needs in a vehicle? SDS sheets, spill kits, etc.
Well, that will partially depend on what services you are all providing. And also depending on the municipality and state regulations that you work in. So for us, standard across all of them are SDS sheets, labels for everything they're working with, spill kits, a basic repair kit or maintenance kit for whatever kind of tools or operations they're doing. Those are kind of the key categories. And then from there, it'll specialize down to, if you're doing sprays, having a backup spray gun, having backup PPE. If you're doing trunk injections, having backup parts or replaceables or consumables as necessary. But the overall, overarching is legal requirements. So SDS sheets, first aid kit, and the like, and then universal operational things. So operational guides, spill kits, for whatever services you are specifically providing.
Yeah, another thing too that we, Kyle, just to tag along on what you're saying, is we have accident information sheets as well. So if there is like an incident, it helps like that individual kind of guide them through those situations, getting the information, what to say, what not to say type things for like an emergency situation like that.
All right, now we will be moving into production section of questions. What are any tips you have for scheduling injections and other services efficiently, especially considering weather and uptake time differences?
Paul, do you want to jump on that one first?
Yeah, so for scheduling, obviously weather is a huge factor and uptake for us. We're just getting started currently right now for our burr oak blight treatments here in the Midwest, and we're factoring weather right now. We're gonna go give it a try. Obviously our temps are very low, right around freezing mark overnight, and they don't get very high during the day, 42 to 50. So, so usually for those, we just get out, like on Monday, we're going to give it a shot and see what it looks like. If it's a slower uptake, then we'll backtrack and we'll go to something like our 2-line chestnut borer treatments that will be not instantaneous, but they will be a little bit quicker and stuff. So we look at timing as well for those services. So right now, Bob, we have, through mid-May, third week of May is when we need to have those completed by, and they have a short timeline where the injections are appropriate for those treatments. And then you get into, your ash treatments and your elm and oak treatments later on in the season. So timing is, for us, is a big thing. As far as the efficiency of it, it depends on how your crew structures are and how much work you have and how many techs you need for that as well. And you kind of plan out ahead of that as far as what the season looks like, how many trees you need to get done per day and type thing like that. For uptake time differences, it's really varied. It bases on whichever it could be. The tree could be next to another tree. One could take up in 10 minutes, one could take up in an hour. So it really depends on the tree for uptake time differences on that. But
and once you step away from injections, using what is called growing degree days is really, really effective, especially after a handful of years where you can tailor it in for the growing degree day progression for your location. It'll allow you in the future to forecast really, really well based on the temperature progression. So you'll know the next 10 days forecast, you're going to gain 10, 15, 20, 30 growing degree days, and you'll be able to forecast how quickly various diseases, various pests are going to emerge. So using growing degree days is highly effective, and it will allow you to go year from year. So a year starts earlier, a year starts later. It doesn't really matter because you're going off of growing degree days. At 10 growing degree days, this happens. At 100, this happens. At 200, this happens. So you're not worrying about the physical dates. You're just worrying about the season progression. So that we found to be really, really effective.
Yeah, for us this year, we're 2.5 weeks ahead of schedule than we were previous years, just based on that. So,
All right. How do you accommodate for variations in tree injection time when estimating the cost of treatment?
None of the three of us are actually in sales, but I do know that they have a pricing structure, and it's kind of like a sliding scale, if you will, where based off of the DBH and size of the tree, it does vary based on the time necessity, the product amount used. I can't speak too much on the details, but it is essentially a structured scale that at DBH of 10, it equates to this cost, and DBH of 20 equates to a new cost, 30, 40, 50, all along that scale. That being said, some of the treatments don't actually vary that much by the size of the tree. Emerald ash borer treatments, treating a 10, 15-inch tree and treating a 30-inch tree, your biggest difference is the number of injection sites. So the functional difference might only be 2 or 3 minutes. So it doesn't really play a ton into the pricing structure.
I'll add a follow-up part to that, and you can decline if you want. But say like when you were talking about before, like some trees will take 10 minutes and then the one right next to it will take 30 to 40 minutes. Is there any consideration, or is that negligible difference?
It's not really something you can take into consideration prior all the time, simply because you don't know the full condition of that tree. What is its root structure like? What is its internal vascular tissue like? What damages has it all experienced? So just from a outside glance, you can't always get a really good view at the internal health of the tree. And it'll also really affect based on the weather. If you go out to that same tree on a cool day, light sun, breezes are flowing, it's going to take up differently than if you try and go out and inject it 90 degrees, the stomata are closed, not a lot of transpiration is happening. So that exact same tree might take 10 minutes on one day in one condition, but it might take 35 on a different day in a different condition. Nothing different about the tree. It just happened to be the conditions in which the treatment took place. So you can't really bill for the day you're going out.
All right. Moving along, how do you keep track of customers who want additional work applications next season on top of their regular renewed services?
So if I just trying to make sure I understand it completely. So this is, say we're going out and we do apple scab spray, and next year they want to add on a Lepitec treatment for Japanese beetle. In our system, we can go in and propose those treatments well in advance. So what we would do is we would relay the customer's request to the consultant. They would put together a proposal. They'd go and check the trees. They'd make sure everything's in order, that, yep, this tree does need it. It is susceptible to the disease or the pest being worked on. And they can put a proposal together. It would go into our system, which currently we're using Arbor Gold, and it would just be scheduled for next year. I believe that kind of answers what they were looking at.
Yeah, I think you nailed it. How do you manage quality control in the field?
I'm giving this one over to Paul.
Yeah. That's a great question. Our goal is to provide the best quality possible, and so managing it can be extremely tough, but we have some things that we put in place so far. We do, it starts in the beginning. For us, it's training. For us, we deal with a lot of seasonal techs that are providing these services. So at the top in the beginning, we focus heavily on training our protocols and really walk them through that. We're holding their hands a little bit through that process just to make sure that they understand everything. And as they get through the beginning part of the season, we slowly ease off on some of that part and let them get out. But as soon as they become more confident is when we kind of let them go out. And what we'll do is we do a lot of site audits. We'll go out, we'll work with them in the field. We'll check their live sites as they're on site and just work with them and kind of correct anything. When we go out, we're not looking for pointing fingers and being like, you're doing this wrong, you're doing this wrong. It's more of like a support to them and educating them to give them more confidence in what they're doing. We'll also go back and back check those sites that they've completed ahead of time before we visit them as well, and really walk the whole site from beginning to end. Looking at injection sites, looking, did they excavate the root flare if they're doing a macro injection? Did they tag the tree? We'll look at the computer work and see if they documented everything correctly. And did they leave stuff on site? What does the site look like? Does it look like they were there, but they weren't there? The cleanup of it. And if the homeowner's home, talking to them too, what was their interaction like with that certain tech? Some people are not used to going out and actually communicating or talking to a lot of different homeowners. So, that's another form of training where we can coach them on that and just get them more comfortable with that. But there is a little bit of handholding in there. But if you think of some of these techs have no idea like what they're up to yet, and this might be the only time they ever do these services. It's really important to give them that guidance and to really, coddle them a little bit, but just really support them to give them the confidence. So 3 weeks into the job, 4 weeks into the job, they have 2 months left. That tech is performing exactly how they can help them as well. So quality checks, it goes with training and a lot of safety aspects in there too, and stuff. But we do a ton of it all year round, and especially in the summer months. And then we also have our team leaders in the PHC department. We meet once a week and discuss certain quality assurance things as well, and look at the different texts and discuss like who needs what, or do we think we could work with this person a little more to get their tree average up for the day, or what's holding them back. Like, are they just not following the process step by step and they're getting in their own way? So it's really more of supporting them and giving them the benefit of having us out there to make them a great employee. So yeah, Kyle, I don't know if you have anything else to
No, you
touch on that.
covered it completely.
Yeah. Yeah, the quality control thing is something that we take really seriously here, because it's we're providing a service and we really want them to we wanted to uphold our values. So yeah, and it's a lot of fun too.
All right, perfect. Next question. What are the biggest challenges, potential pitfalls, and things to avoid in forming a new PHC team?
A bit of a broad question. What I would say are the biggest challenges, especially if you're forming a brand new team, is getting everyone up to speed to the efficiency, the quality, the professionalism that's necessary in what is typically a very, very quick season. I'm not sure where everyone's located, but especially for those of us in northern climates where we have 3, 4, 5 months of non-production, a lot of times we're having to bring in someone who's brand new, doesn't have a lot of experience in arboriculture or the green industry, and we're having to train them all the way up in the matter of a few weeks, because you have dozens and dozens of different pests and diseases all rapidly forming, and you need to get out there and work with them. So the biggest challenge is probably having a very structured and very thorough training process. So at the end of it, you can be relatively confident that the new technician is going to meet certain standards of quality, efficiency, professionalism, and all of that. So that also plays into the potential pitfall. If you don't have that training process, that onboarding process of getting people to understand what they're doing, why they're doing it, the reasons for the protocols and regulations that you have in place, you can end up with people essentially kind of making their own decisions on what is appropriate, what should be done, how they should address any type of challenges or eventualities in the field. And you really don't want that. You want that consistent treatment, that consistent result every time, from if you got 5 techs to 100 techs, you want them all doing it that same way. So everyone's getting that same quality, that same level of treatment, that same level of customer service. So making sure you have a process that everyone goes through the same way, gets out to that, at least that same level that you need them to be at. That's all I got.
Right.
Yeah, I'll just throw something to tag on there too. It's really important that when you form your team, and Kyle is awesome at this, is offering support to the team and stuff, and just making sure that you're available for them. I know if you need something, being available for them. A pitfall would be if you're not available when they need you. It's just really important, especially in the beginning stages. I know if you have a question for us, and like when a Kyle's texts are out, he's on it, like he's right there, and it's really important to be able to help them through that process.
All right. What are some tips you can provide on managing product and equipment inventory?
Some of the things that we do for equipment is it depending on the what do you call it, the service is we actually give the technician signed equipment instead of having them be able to grab different types of equipment every day. We eliminate a lot of breakdowns with that equipment, so we assign the equipment to the technicians at the beginning of the season, and they'll keep that equipment throughout. As far as product, the best way that we manage our products is by having people that do the check-in, the check-out, the inventory management. You don't want your managers, your foremen, taking time off their schedule to manage any of that. You have to have dedicated people to manage that.
Yep, and to play off of that, how it kind of exists for the actual field technicians, our warehouse staff, which is headed up by Jesus here, actually pre-stocks a bin with all of the different treatments, all of the different products that we use in all of our different services. So a technician comes in, they grab their bin, they have a checkout sheet, so they verify that they're leaving with, I've got 1 bottle of this, 2 bottles of this, 4 ounces of this, what have you, and they're able to just grab that and go. One, that cuts down on the mobilization time in the morning. They don't have to hunt around to try and find a bottle. They don't have to they don't go out in the field and realize, oh, I forgot something. They're just grabbing all of the services, all of the product for all of the services we could do. And what makes that possible is breaking down the quantities. So if you have something like propiconazole, it might come in a 2.5 gallon jug, but you might only be using it at a rate of 4 ounces per 100 gallons. It's really impractical and just not efficient to have everybody having that 2.5 gallon unit. You're overbuying product. It can last too long and it can spoil. So we break that down into smaller quantities. So we're able to really, really accurately measure what a technician uses in a day. So they'll go out with an 8-ounce bottle. End of day, they return that same bin. The warehouse staff goes through it and they can see, hey, they used up 6 ounces of that propiconazole. That gets tracked by every technician every single day. And what that allows us to do is track it over the entire year. And then that plays into year over year over year over year. So I can go back and look at the previous 3-4 years of product usage by day to get a forecast for this year. So I know in the first 3 months, we're going to use a certain amount of various products. So you can purchase what you need. You don't over purchase. You don't under purchase. It allows you to forecast really, really accurately based on historical trends. And you could also have that play into, if you know you did $100,000 of a specific service and that correlated to using up 1.5 bottles, and you know this next year you have $200,000 of that service, you can correlate that to doubling your product usage. You know you're going to now need 3 bottles. So having that documentation and really accurate record keeping on product usage plays into like future forecasting that just builds upon itself year over year over year.
Yeah, another thing that it helps out with is we have a warehouse that's pretty small, and us dealing with so many different divisions, different types of services, there are services that require a lot more warehouse space, a lot more product. Being able to figure out when you need the product. So if you need something for August, you're not going to bring it in March. One, it'll keep you from spending that money, and also it'll keep your warehouse free of that product and utilizing space that you could use for other products. So it's a great tracking tool. It's a good way to also show what is being sold and used and all that.
All right. We did have a question come in the Q&A chat. You seem to have decent success with hiring a good number of technicians for your PHC season. Where do you advertise, and what does that advertisement state when looking to hire?
So we actually on a lot of different places, really. So we exist on Indeed, various job posting websites. We'll post a standard job description, daily tasks, compensation rate, basically just a basic job description. So that's one of the big ones. We also traditionally would go to job fairs at universities. That hasn't really happened this year for obvious reasons, but that's one where we've had pretty decent success. And that's where myself, our recruiter, other individuals kind of in the division would go and be able to talk person to person on exactly what the task is. And that relates really well, especially to college individuals, where a basic job posting won't jump out to them. We also implement on Facebook for our seasonal hires. Where else? I know Matt's involved with it.
Yeah, I was gonna say I can add in right now, like you said, there we did do career fairs. That was a big thing over a year ago. This year we've put more of the resources into digital. So we have a few different ones that are like more specific on Facebook and LinkedIn. We have some, and then what we try to do is utilize our employees that are on our social media pages to share that out to their networks. That's kind of a cheaper way to do it. Or you can create like an advertisement. Through social media, you're limited in, like, if you're really looking to get college students for seasonal work, you don't get to change any of those demographics you're looking for anymore through the platforms. What was another one? Indeed, LinkedIn, Facebook. Oh, and we used Instagram. I don't know if you listen, if any of you were on the marketing talk that we did about a month ago, maybe. Instagram, the demographic of the users, it skews younger. So we get a lot of those college students still by doing paid ads through that. So we use a lot of the money for those. I guess things that we say would be seasonal job, summer job, working outside. Kind of, I've used being your own boss to a degree as well, because they are required to kind of be self-sufficient for most of the part. We do have a team to support, but when they're out, most of our techs, and correct me if I'm wrong, Kyle, most of them are one to a vehicle and they kind of manage their day and their routes. And so a lot of that is enticing for a lot of people, especially younger college students. All right, let's see. We had one more come in. Another.
Yeah. I don't know if you guys touched on it too, Matt. Sorry, my computer is freezing up. Let's see if you guys touched on it. I think
Oh, might want to just turn off your
we
video.
do is,
You're breaking up really
referral
bad.
to and from colleges. Referral.
Okay, I don't know if Paul, if we lost Paul.
From
Well, we'll see if we can get him back.
Yeah, try and get him to hardline and maybe
Overall.
shut off his video camera. That might help. There was another hiring one. What percentage of new hires take the company training and then leave after a season to start their own business?
For plant healthcare specifically, it's never happened. We haven't lost any individual to that. We have had individuals in our pruning division that have kind of broken off on their own. But for plant healthcare, in the last 8 years I've been here, it has not happened.
All right, we'll go on to the next one. What routing programs do you use?
Our scheduling and routing all exist in the same system and is called ArborGoal. It's one that's we're working with the company to develop it more and more towards PHC specific functionality. So that is what we currently use, and we're just getting consistent updates about every week.
Okay. How do we improve the efficiency of our plant healthcare crews?
Obviously the biggest thing is identifying where is the inefficiency coming from. So addressing that is kind of the second part of it. So is it inefficient routing? Is it inefficient sales? Is it inefficient scheduling? All of those will have different approaches. One of just kind of an overarching is working with the technicians in the field on actual job sites on their service delivery. That's one that, no matter all of the other components, is one that's going to be universally applicable. Each individual is going to have their own kind of process, their own kind of approach, and a lot of them might not be the most efficient and most time oriented approach. So having someone who has experience going out, working with those new technicians, or even the experienced technicians on continuing improvement is really, really important. So that's where I'll go out and I'll work with a technician for 3, 4, 5 hours, and we'll be able to take their time on site from, say, 30 minutes to complete a spray treatment down to 20 or 15. And when you're doing 15, 20 different sites per day, obviously cutting off 5, 10 minutes really, really adds up. So that can bump up that efficiency, that productivity really well, apart from addressing any type of scheduling, routing, or functional efficiencies that may exist. And all of those would have their own approach. If routing is an issue and you're finding out you're having to do a lot of revisits, or you're going back and forth across your metro area, taking a look at whatever your routing protocols and your routing system might be. Another really good way is consolidating the treatments. If you have a large enough scale where you can go out and just do single treatment days where you're going out and only applying imidacloprid or only applying apple scab or anything along that lines, you're reducing the inefficiency of having to mix up back and forth. And you're also really, really cutting down on the potential for cross-contamination or off-site application. So even if you're going to the same site, might have an apple scab treatment and a Zytec treatment. One is a fungicide on a plant that flowers that's going to get pollinators. The other one is a soil applied insecticide that is extremely toxic to pollinators. Having dedicated separate tanks, separate hoses might allow you to do them both at the same time. If that's not an option for you, routing them on separate days, well, at the first, it seems inefficient because you have to revisit. It's also a payoff of not having massive bee kills or any type of issues where you went from Zytec to your apple scab spray, and unless you're darn near perfect, you're going to get some sort of bleed through when you're switching. Avoiding that is important. It's important. So routing in single system or single treatment routes where you're only doing 15, 20 treatments of Zytec all day allows you to mix up a larger quantity, avoids remixing, and it does really pay off quite well for numerous different reasons.
A couple other things that help too with efficiency, even though it's not, they're not on the field, is not having them here in the warehouse, not having the technicians be looking for products. So having everything in the bin quantities like we do, and then also having that bin quantity, being able to have the ability to have all the products that you would need for the time of the season, and for them to be able to switch off to a different application. Say if they're out doing sprays and it gets too windy, they can immediately switch over to doing a different type of application, the soil applied or whatever, since they already have the product with, instead of before they used to have to come back to the shop, have to grab the product, go back out and produce, where they just switch over on the fly right there. That has also been something that we created efficiency by doing that.
Yeah, for me, you guys can hear me okay now, or?
Yes.
Yep.
I apologize for the video and stuff. Yeah, for me, again, it starts with like the training and stuff and really getting them in tune with the process of like what we're doing. And a lot of my focus is on injections. And one thing I provide for the techs as we go through the training is like a step-by-step like way of doing the process. So it helps them guide them and like reference if they're lost in like when they get to the job site, what's the first thing they do all the way to the end of it. If they get lost in that process, they can refer back to it. But once they get those habits down and develop those after a few weeks and get comfortable with it, you can see their efficiency really increase on site and being able to get that tree up and going. If it takes, in the beginning, it takes them 40 minutes, after 3 weeks, it takes them, 15, 20 minutes to get it up, just because they're, following the steps and they're not, doing things out of order and stuff. So there's steps that they can take as well to make it a lot more efficient on site and not spend time doing something that, they can do while the tree's uptaking or those type of things. So.
All right. Next question. What's the best way to get predictable results that you can advertise for future clients?
Yeah, that's a big one. So, I mean, you'll hear us repeat ourselves a lot because they all kind of play into each other. So one part is making sure you're having a uniform approach. If you're going out and treating 100 different clients at 100 different sites, making sure they're all getting the same treatment protocols in the same manner at the appropriate time. So at Rainbow, we've done quite a bit of just kind of R&D on the products we use and the systems that we use. So every tree or every birch that's going out and getting a imidacloprid bronze birch board treatment is getting it done at the exact same protocol, the exact same method. Soil injected, 125 mils of imidacloprid per 1 inch of DBH, and having that consistent year over year and site over site approach will really tailor it into a predictable result. You're always going to get a certain amount of variability, especially with fungal sprays, where each season's growing conditions are different. Right now, for us, we're having cool, wet conditions for just going on almost 8 days right now. We're going to have a horrible fungal season. There's going to be so much fungal growth, it's not going to be funny. On a different season, you're going to have much less if it's been a dry, warm fungal season. So on those, there's a certain inherent amount of variability just with a growing system, but making sure everything gets the same approach, treated at the same growing degree days, following the same training protocol, you can start controlling those variabilities as much as you can.
All right, we did have another question come in through the Q&A. How do you manage calls from people who request an estimate for treatment but are actually seeking a diagnosis as a free consult so they can attempt the treatment work themselves?
This would be one I would have to reach out to Tom Carmen. We actually have a dedicated team, our consultant arborists and our associate arborists, that go out and do the site audits and the inspections and the consultation. It's not an area that I actually am dealing with at all. So I'm unfortunately I wouldn't be able to answer that.
Yeah, and I can only answer superficially from the time that I've done customer service and tech support. I know most of them will have the consulting arborist come out to the property. And I mean, the amount of people, I guess, that would actually turn around and do the work themselves is very little. I mean, just thinking of ash injections, I mean, a bottle costs what, upwards of $400 or $500 for a quart?
Yeah, 480 to
versus
600, depending on what you're buying.
versus about $100 for 2 years. So you're like $50 a year. I mean, and most, like, the amount of equipment, I mean, from my experience, it doesn't happen all that often. But yeah, I would defer to Tom Carmen or maybe one of your territory managers for maybe a little bit more elaborate answer. Let's see, we did that one. Going on to the next one. How do you handle an employee that is not performing at the expected level?
Paul, do you want to take this?
Yeah. So from where I'm at, it starts with training, obviously, and if they're having issues with it, like maybe with a process or something, we have moved techs before into like a different application before where they might succeed. Some succeed really well and perform well better with teams versus individually. And sometimes you don't find that out until they're actually out working and stuff. And it's really getting to know that to that employee or whatever, and kind of working with them what works best for them. But if they're not performing at the expected level, it's getting out on site with them and really looking at their process and working with them and taking the time to get that, because there might be something in their way that they don't even notice. They think they're doing everything right, and then maybe they're not checking the filter, and like there's a in your macro injection when you're doing elm or Dutch elm disease treatment, and that if that filter is clogged and they're not checking that, I mean, that could go from a 45-minute uptake to a 6-7 hour uptake. So really getting out on site and seeing what's in their way, and then and working with them and getting them to develop those habits that really get them up to speed. And if they aren't performing after that, and maybe it's the tech themselves where they're just not invested in what they're doing, and it's just a job, they don't care, then you have to meet with your management team or your team and discuss like what the next appropriate move is. But as far as performing, I think it's getting out on site with them and really working hand in hand with them and going through the process and seeing what's in their way. And it might be something as simple as the filter, or it might just be they aren't fully understanding the process or what have you. So.
Yep, I would agree.
All right. How do you set daily quotas and expectations?
So easiest way to do that, I found, especially in our traditional plant healthcare, so soil injections and sprays, is we set a RPH goal, so return per hour. That lets each individual technician know what goal they're looking for overall for the day, for the week, for the month. So they can keep pace. If you're expecting to do $3,000 in a day, you get halfway through the day and you're only at $800. They're starting to identify as like, hey, I'm going slower than expected. And from there, we can work with the technician, similar to the previous question, to identify what challenges or what obstacles are they running into, what is slowing them down. So just being very upfront, very forward, like, hey, these are our goals. 10 trees injected or a certain amount of production completed, anything like that really helps, because then there's no questions, there's no confusion. I'm like, hey, how much should I be doing? What's the goal? Having that in front of them and identifying anyone that isn't meeting that and working with them to raise them up. So I actually track every individual every single day over the entire treatment season, and I keep that for year over year over year, so I can get an average of 50, 60, 70 different people on the exact same treatment, so I can tailor in what is a realistic RPH goal for whatever we're doing at any given time.
All right. How do you deal with work orders that are underbid or unclear?
For underbid ones, at least, there's not really much we do about it for a production side. Our consulting arborists have various meetings with their supervisors and their kind of organizational structure. So if they're seeing that their return per hour or their profitability for services is lower, their supervisor works with them on saying, hey, you're not bidding these correctly. And they'll go out, similar to like what we do with the production team, they'll go out with that consulting arborist and walk through, like, this is the process, these are the steps, this is why you're ending at an incorrect bid. So they have their own kind of feedback loop of, they review how the bids are coming in, the profitability and the return per hour for each individual. Those that are on point, great. Those that are missing it will go out for continuous work. If they're unclear, as in like the site isn't mapped or the information isn't all available, our technicians email the consulting arborist saying, hey, you didn't provide the service category, you didn't provide the canopy area for our tree nutrition, because all that calculates into how much to apply to the tree, and without it, we can't work. We'll simply email them, we'll call them if we can get feedback quickly, but after about 5-10 minutes, if they don't respond, we'll shoot them an email saying, hey, 123 Main Street, Mary Sue, there's no canopy area for the tree nutrition work. Get that back to me. I can go back. I'll go back later and do the job. So if it's unclear in a manner that prevents you from doing the work, we'll reach out to the consulting arborist. If they don't get back to us quickly, we'll continue moving on because we've got hundreds other ones to do. If it's unclear in a non-job altering, just like, hey, they missed the product name, but we know we're going out to treat bronze birch borer, the technician will call me. I have our complete service guide. I'll open it up and I can look up, hey, we're treating with a Zytec the bronze birch borer, and I'll just answer it for them.
All right, now moving on to recruiting and training. All right, you might have touched on this earlier. What is your approach and how do you train PHC technicians?
I'll do a little bit, and then I'll turn it over to Paul. So our general approach is for the traditional plant healthcare, so sprays and soils, we'll bring them in. They'll have 2 days of classroom training. Right now it's being done via Zoom, but we just call it classroom training. That's where we're going over the history, the knowledge base, the introduction to PHC, arboriculture, the green industry, really laying out what it is we do, why we do it, why it's functionally important. And then from there, we move into field training. So first step is a group training where we're going over the vehicles, operation of the vehicles, of the tools, how they work, various calculations on how to determine how much product to mix up, just practicing in a group setting for about a day. Then the plant healthcare technicians are paired with a experienced operator, so somebody who's been doing it for a handful of years, and they will go out to actual clients' properties and do actual work under the direct supervision of the experienced technician. So that's where they're practicing filling out their paperwork, customer interaction, tree ID, all of those things that, as much as you want, you can never fully replicate in a controlled environment. And then they'll be paired up for a handful of days until they're comfortable, they're confident in their own methodology and their own ability to work independently, at which point they're split up and everyone goes out individually. So that's our traditional plant healthcare approach. For our injection systems, it's slightly different, and I will turn it over to Paul for that.
Yeah, thanks, Kyle. Yeah, the for injections, we're pretty similar along the lines as the classroom training and all that kind of stuff. You know, we go through the history and what we're treating for type thing. And we have different speakers come in through the company that specialize in some of that stuff as well, just to help with that process. And currently right now, obviously it's through Zoom, but it used to be classroom. Eventually we'll get back to that, hopefully. But you know, then the driver training, you know, things like that. And then once we get into after the classroom stuff, we do like 3 days of kind of introductory field training where recently what we would do is we would split up the techs into 3 to 4 per group. And we have people that we've worked with that have been in like a leadership role for us seasonally, like a crew lead style. We'll go through the process with them before we break out into these groups and just refresh everybody. But we get on site and they do like a demo tree, and then each tech will have their own tree to start on and really get the hands-on guidance. You know, we don't we don't like to do like the big group thing. It's better individualized if you can have more of a hands-on classroom setting outside. So if you have 3 to 4 techs per person training them, they're able to offer more hands-on approach to it. And really they walk them through each step, get them more comfortable with it, and and guide them through that process. And then once the training is done, that usually is about 2-3 days of that. Then they start their actual field work and stuff. And what we do is these techs are more individualized now when they go out to the field. So we'll have them all kind of in the same area, each group of 3 to 4, with that same person that they trained with. And that person that helped train them will be there to assist them as they get started and help them really gain confidence and on what they're doing and stuff. So a lot of it's hands-on. It's all about getting in there and being with them. And when you're training them, the biggest thing that you can show them is, well, obviously is the correct process on how it's done, and all done with quality and in respects to that, but also like the pitfalls, the things that could go wrong. So you're not showing them just how to do it correctly, but you're also showing them like, these are the issues that you're going to run into potentially, and this is how you correct those issues, and this is how you're going to fix this. Or if you have to go above grade because there's half the roof flare is decayed out, or or whatever the situation is, you're really showing them some of those as well. So yeah, the hands-on is extremely important. And then it's the onboarding process kind of continues a little bit into the season, as far as like you're always continually training, kind of like a continued education format, but you're always out there helping them until they're ready to get out there on their own.
All right, we did have one come in the Q&A. Do your PHC technicians have to have their IPM and landscape pesticide certification previous to hire and company training?
So for Minnesota, we require them to have their Minnesota pesticide applicator license. Yes. I'm not sure where you all are from, but every state is going to have slightly different regulations. In some, you are able to have one license as a supervisor, and everyone kind of works underneath that. But for us here in Minnesota, everyone has their own pesticide applicator's license.
And do they need that before you hire them, or will you hire people without it and then they can get the certification?
Most people don't have it prior to hiring. We'll set it up and it'll traditionally be handled before their first start date. If it's not, it's usually within that first week of training. And you just have to operate around who can apply and who can't based on when they get their test.
All right. How do you coach trained technicians to have homeowner conversations?
Paul, do you want to jump on that?
Yeah. Well, sorry, I'm just kind of breaking up a little bit. Can you guys hear me okay?
Yep.
Okay, perfect. Yeah, so as far as like coaching and training the technicians to the homeowner conversation, it's really important for on the onboarding process to get them up to speed and understand what you're up to, why you're out there, and what you're doing, and then have them understand if what your values are in your company. And it really helps with that when you're talking to the homeowners. One thing that we don't want the technicians saying is something that they don't know the answer to, giving them false information, just making something up just to give them an answer. It's really important that if they don't know something, they tell them that, and we'll have the right person get back to them. Sometimes they'll call myself or whoever that they're working with and get the answer, but making sure that they get the correct information. And then also I think it's really important to look at it from like from a homeowner's aspect as well. When you're having a conversation with them, it's not, when you're out there with them and you see let's say you're working with a homeowner and their tree is not, they don't really, you know, we don't value the trees, I'm saying, is like the homeowners do. They see it every day. So really looking at from their side, and like, you know, some of these trees were planted in memorial, or have significant meaning for these people, and really just, you know, looking at it from their side too. So I think the biggest thing is just really coaching them on what to say, you know, letting them get out there and giving them the right information to discuss with the homeowners, and really empowering them to say, I don't have the answer. A lot of people defer to, you know, I just making something up. So making sure that they understand that they can say, I don't have the answer. And the homeowners actually really respond well to that. And like, oh, I'm glad that you're honest about that. And we'll get back to you with the correct answer. I don't know if Kyle, if you have anything else to add to that at all.
I do not.
All right. Let's see. It looks like we touched on this one. What type of certifications do you require new hires to have or get? The IPM, pesticide, and that does vary from state to state.
Yep. So for us, it's just the Minnesota pesticide applicator's license. And depending on the type of vehicle, they might also be required to get a DOT medical card.
All right.
Yeah.
Yeah.
One thing we do, oh, it's not really a certificate. I guess it would be considered our own certification, I guess. But it would be, we do a driver's test in-house just to see how they operate those vehicles as well. I don't know if it's really a certification, but it's, we can test them to see how they handle those vehicles and if they're able to drive those or not.
It can be considered certifications, but it's not an official one, but yeah, it can be.
Yeah, kind of an in-house.
Yeah.
All right. We got about 4 or 5 minutes left, so try and squeeze in 1, 2 more questions maybe. What tips can you provide for establishing a strong safety culture?
Big part is having a environment or a culture that is focused more on improvement and learning rather than retribution and punishment. When something goes wrong or something that is unsafe, obviously the scale and scope of it matters, but skewing more towards using it as a learning opportunity, a growth opportunity, is really important, because if a technician or an employee is afraid of retribution or afraid of getting punished, they're less likely to report any issues, report any incidents that happen. So you're kind of working against yourself. An environment of fear is just generally not a great approach to try and build any type of healthy culture. Of course, that being said, having the rules and regulations and protocols that you have and making sure they're enforced. So there's always a sliding scale of, if the issue is big enough, then yeah, there's punishment or retribution or what have you that is appropriate.
All right. I think we got one more. How have you adjusted to COVID-19 and social distancing best practices?
Well, one, we've moved to the completely digital scheduling system, so that was a big one. And I'll turn it over to Jesus because he's dealt with a fair amount of this.
Well, it all depends on the division. So there's different ways that we provide the products to our divisions, our people. We try to avoid a lot of people in the warehouse or in a confined area. So what we do is, for like inject here, they have their own crate, or it's a pallet that we modified, and we put all their stuff that they need in there, whether it be products or PPE and small tools. We throw that everything that the division needs. We throw it on the pallet, and we have schedules on when they're gonna be here and they're gonna grab their stuff. And then we throw it out there about half an hour before they get here. And that's for like 3 different types of divisions. And then tree care, they come out of the warehouse, but we separated them, try to separate the bins and where people kind of stage within 6 feet. we're always wearing gloves, masks. We require them in-house. So yeah, we provide cleaning solutions if they need hand sanitizer, spray bottles of cleaning disinfectant. We provide all that for them.
Yeah, from the tech side, when they're out, they're all individualized. Each person has their own vehicle they drive. We don't share vehicles currently. Masked up when you're on a homeowner's property, masked up obviously, and then 10 feet away from those, from the homeowners, and things like that. And then also in meetings and stuff like that, we do like these spaced out meetings in a big circle, if in small groups, or Zoom calls if we need to. But yeah.
But one of the things that the warehouse has done, since we deal with the whole company in general, is and we kind of, everything that goes through our company it's touched by us. We wear gloves and stuff like that. So every product that we take, or every piece of paper, everything that we touch and grab is we're wearing protection. Not really for our protection, but more for everybody that we deal with.
All right, and that puts us at time. So we will stop there. Thank you everyone for joining us today. And thanks Jesus, Kyle, and Paul. I appreciate the knowledge. We do have some upcoming webinars still. Spotted Lambfly research update, as well as field demonstrations. And before you log off, there will be a short survey. We appreciate if you take the 5 minutes to fill that out. That helps us guide our decisions in future webinars and formats. And with that, thank you everyone for joining. Have a great rest of your day.
Have a good one.